Okay, ladies and gentlemen, our next unit is Unit D, and that is personal characteristics of a healthcare worker. Our personal appearance involves more than just your clothes or your hair. It involves good health, which means your diet. You want to make sure that you get a proper diet, plenty of rest. You want to make sure you have adequate rest, especially if you're going to go take care of people at a hospital or wherever you're working at. You want to make sure that you're rested well. We need to make sure that you are having good exercise routines, that you're getting enough exercise. Posture is good. Good posture leads to good health, because if you're slouching all the time, it can cause back problems, neck problems, things like that. Of course, it goes without saying, you need to avoid tobacco, alcohol, and drugs. Now, the things that we're more concerned about when we talk about our appearance, we think, is our uniforms, which is our clothing, what we wear. We need to make sure that we are wearing the proper uniform. Like, for example, at Vidant Duplin, all nurses, whether you're an RN or LPN, has to wear black or white or a combination of black and white. That signifies to your patient and their families that anybody that comes in the room that's in black or white is a nurse. Okay, so nobody else in the hospital can wear that. So it does let us know what position we hold. Make sure that your uniform is clean. It's not got stains on it. It doesn't stink from, whatever smells you have at home. That it is ironed. We don't want wrinkled up clothes that you just took out of the clothes basket and threw on. If your pants are too long, have them hemmed. Please don't walk on your pants legs. Okay? Shoes. We need to make sure that we are wearing proper shoes. We need shoes that give us good support for our feet. If you are up on your feet for 12 hours at a time, you want to make sure that you wear shoes that are supportive. We need to make sure that we don't wear open-toed shoes like flip-flops or sandals in any way, because we need to protect your feet. Typically, we're going to wear tennis shoes, dance goes, something along that line, okay? We don't want the shoes to be dirty. You don't wear the same tennis shoes to work that you mow the grass in, okay? A big part of your personal appearance is your name badge. Every person that works in a health facility has a name badge. It signifies who you are and your job title, because we wouldn't want someone from dietary coming in and delivering your tray, or coming in to talk to you about your lunch tray, and you thinking it's your nurse. Okay, so they have different color clothes on, and they have a name tag on to tell you what their job title is. Personal hygiene goes without saying. Guys, take a bath every day. We think that's the norm, but sometimes it is not. So make sure that you're clean, that your clothes are clean. You don't have a ton of cologne or perfume on. You need to just have a natural smell. You don't want to just have tons of perfume on or cologne on, and your patient's in ICU with COPD and they can't breathe, and you're causing them to go into an asthma attack because of your cologne. So make sure that you don't wear too much cologne. Your nails should not be painted. Typically, red nail polish is frowned upon. We don't want red nail polish. It's something that is a natural appearance. Healthcare workers cannot wear acrylic nails either, okay? Because germs can get under those nails. Your hair needs to be pulled back if it's longer than shoulder length. That's so your hair doesn't get in your patient's wounds or whatever if you're leaning over them doing a dressing change. And so pediatric patients can't grab your hair and pull at your hair. Jewelry needs to be kept to a minimum. We don't want a lot of jewelry. You don't want big hoop earrings to where your patients can grab it if they're confused and pull your earring out of your ear. Plus, jewelry, your rings and stuff can carry germs from one patient to the next, and it'll carry germs to your house. So, very limited jewelry, okay? One of your test questions is going to be if you are wearing a ring and you don't want it to get contaminated or dirty, or you don't want to scratch your patient, You can pin it with a safety pin on the inside of your uniform, and that's an old way. Women used to do that. Of course, we don't do that much anymore, but that is a test question, okay? As for makeup, we want to make sure that you don't look like you're going clubbing, okay? We want your makeup to give you a natural appearance. It shouldn't look like you look like a clown or you're going clubbing. Now, different characteristics that we need to look for in a healthcare worker. Empathy is being able to identify with somebody else's situation. And if you look at this picture, is that a 6 or a 9? And it's both. It depends on how you look at it. So you need to be understanding of somebody else's views, okay? Not saying you have to agree with them, but you need to be understanding of them. Honesty, of course, truthfulness and honesty is going to get you anywhere, school, wherever. Just like these quizzes and tests, don't be Googling. Use the notes I give you. That's honesty, integrity. Dependability. If you are going to work, please make sure that you're on time, that people know that you're coming in. They're not thinking, well, gosh, is she going to show up today? Sometimes she shows up, sometimes she doesn't. Be dependable. When it shows that link in that picture, you don't want to be that weakest link. Okay? You need to make sure that your co-workers know that they can depend on you, and that when you get to work, you're going to do things that need to be done on time and do them accurately. Your patients and your co-workers depend on you. Willingness to learn. Hello, it says it in what it is. Willingness to learn. Healthcare is changing all the time, and we got to be willing to learn. There's new techniques, new procedures. We have to be prepared for lifelong learning if we're going into the healthcare field. Patience, I-E-N-C-E, okay? You've got to be tolerant and understanding of people. Just because you get frustrated and aggravated with them doesn't mean you have to act ugly to them, okay? Please remember, somebody has most likely been patient with you, okay? Sometimes we get frustrated, we have obstacles, but we just need to learn to deal with those and not fly off the handle and act silly. Acceptance of criticism. Criticism is a good thing if it's productive criticism, okay, or constructive criticism. If I know how to do something an easier way than what I see you doing it, then I need to try to share that with you to help you learn. Not to insult you in any way, but anything that I can do as a co-worker, and I can talk with you about it and help you do things better or more efficiently, that's what we need to do with each other. But there is a way to do that, okay? You wouldn't come at them, oh my God, that's the wrong way to do this. Don't come at somebody like that. But constructive criticism can help our practice. It can help us be better people. Enthusiasm, you got to like what you do. You got to have a positive attitude. If you don't like what you do, don't do it. If you don't like, doing whatever, if you're a nurse and you don't like it, then go do something else. Because if you're not enthusiastic about what you're doing, it shows in your attitude and your behaviors. So being positive helps everybody around you. And it says enthusiasm is contagious, and it is. If you smile at somebody and say, hey, good morning, how are you? Then you're going to most likely get a response of, I'm great, how are you? But if you walk down the hall and you're just pouting and frowning, that's just what you're going to greet, okay? You're going to greet other people the same way. That's going to be their response to you. So be enthusiastic about what we do. Self-motivation, it says it in the name, motivating yourself. You've got to have the ability to begin and follow through with a task and do it completely, do it correctly. As a nurse manager, I should not have to tell you everything that needs to be done. Whether you're a nurse, and I use that example a lot just because I'm a nurse, but whatever job you're at, people shouldn't have to put your hands on something all the time to get you to do it. You should see what needs to be done and do it. Just like at home, if you see dishes in the sink, mama shouldn't have to tell you to load that dishwasher or wash those dishes. You can do that on your own. Tact. So if we look at the word tact, if you look at the little pie chart down there at the bottom, it says the majority of what is of tact is not what you say, but how you say it. So if I go up to somebody and I say, well, here, would you like a breath mint? that's a nice way to say, maybe your breath doesn't smell so great. Or if I say, oh my God, your breath smells like something died. Yeah, I'm saying the same thing, but it's mean. Don't be like that, okay? It's having the ability to say something that's difficult in a nice way. Competence. You've got to be qualified and capable of performing a task. If the doctor asks you to go start an IV on somebody, if you've never started an IV on somebody, don't do it. Don't do it. Ask somebody for help. Say, you know what? I've never done that before. Can I go and watch you do it this time? So if you are unsure about anything, ask somebody, okay? We want you competent in everything that you're doing. Discretion. You've always got to use good judgment in what you say and do. Our patients are entitled to confidential care. We've not discussed HIPAA, HIPAA yet, but that is where you don't tell things that you see or hear at your work. Okay? You might find out, Miss Amy Daniels, I heard at the doctor's office yesterday, she has lung cancer. Well, if you hear that at my doctor's office, you don't have a right to go back and tell that because I talked to my doctor about that in confidence. Now, guys, I don't have lung cancer, okay? I'm just giving you an example. Just because you hear something there at your job, you don't give that information out. That patient has a right to privacy just like you and your family do. Team player, you got to always work well with others. There is no I in team. You've heard all that. But I can promise you, you'll get a lot further being a team player and helping others than you will working by yourself, okay? So make sure that you're willing to help other people because when it comes time for you to need some help, you're going to want people to come and help you too. All right, so that was it for this PowerPoint. We will move on to the next one.